Hello, everybody. I'm Jeremy Shaba. I'm a vet student at the Ontario Veterinary College, and I'm here today with Dr. Kristy Kenney, a 2013 North Carolina State University graduate and a current intern at Littleton Equine Clinic in Littleton, Colorado. Welcome.
Thank you. Thanks for having me.
So I thought we could just kind of start off and you could talk a little bit about the internship and all the components of it.
Sure. So it's a year-long internship, as most of them are. And here at Littleton, we have 4 different rotations that are a week long. Each of them have different responsibilities and different doctors that you work with and give you a variety of experience in all areas of equine veterinary medicine. I'll start with our field week is just you follow a certain doctor around. At the first 2 months, you're assigned a certain doctor, but after that, you get to choose based on where your interests are, who you go with every day. And then after your first 2 months, then you're responsible for field emergencies during the day. So, and then after that, you rotate to surgery. So surgery, you're assigned to a surgeon, which is Dr. Dustin Devine, during the day, and you assist on his surgeries that he has scheduled on Tuesdays and Thursdays. And then you are responsible for in-house emergencies and after hours that the emergency intern can't get to. And then also any emergency surgery you scrub in as the assistant. So that's surgery rotation. And then after that follows into anesthesia, where that is you're usually assigned to Dr. Scott Toppin and his medicine cases, and so you manage his in-house medicine cases. And then after the first 2 months, you are responsible for emergency anesthesia for the emergency surgeries that come in. And then after anesthesia, you'll rotate to emergency or ER rotation. And so the first 2 months is kind of intense because during the day you'll be assigned to a doctor, so they get to know you, you get to know them, you can work on your skills for the first 2 months, and then after that trial period, then you're responsible for emergencies that come in between 4:30 and 8 a.m., 4:30 p.m. and then 8 a.m. So that you have a backup for those emergency rotations. So there's always a staff veterinarian that's helping you with that. But after the first 2 months, you're the ones going to see those, primary responsibility for care for the night. And then in the morning, you'll transfer any cases that came into the hospital to another intern.
Yeah. And so you said the first 2 months you're pretty heavily supervised, but it's kind of tapered off now. Do you feel like you are able to make your own decisions, but you have the support of others if you need it?
Yes. Yes. Here, I really enjoy, and I've learned a lot here, the way they have it set up, because from day one, they really want you to think like a doctor, and they encourage you to take responsibility for your cases, but they're always there if you have any questions, and then it's sort of, that was one of the difficulties for me, trying to figure out where, my responsibilities, began and ended, and then and where they took over. But they're always wanting to stay in the loop and then make sure that you're comfortable with what you're seeing, what you're treating. But then they also want you to, like I said, think like a doctor and give you enough leeway to make those decisions on your own. Mm-hmm. And everybody here, one of the great things about Littleton is so friendly. They tell me no matter what time of the night, if you have questions, please call. And I'm really grateful for that.
Yeah. And one of the things a lot of the students are looking for in an internship is the opportunity to to do a lot of hands-on. Mm-hmm. Do you feel like when you're riding with those doctors on field care or going to see appointments with other doctors that they're letting you do this stuff, or is it more observatory?
No, I'd say here is fairly hands-on. The first 2 months are supervised, but they do they step back and let you do it. I mean, as far as hands-on, we do most of everything except for one thing that we don't do is a lot of joint injections. And when I asked the reasoning for that, I agree with the reasoning that was given to me in that when you come to a private practice internship, the people who bring their horses to this practice are expecting the best care, and that's what we promote and sell. So as students, not that we're not going to give them the best care, or interns rather, but when they bring their horse for injections, they're looking for Dr. Tischer or Dr. Swanson or Dr. Beeman or some of the other doctors here that have that reputation. That's what they came for. Mm-hmm. So that's the one thing that we don't get a lot of hands-on experience with. There are certain situations where the doctors try and get us some experience with joint injections, but everything else we do, we work up colics by ourselves, tube, rectal, IV injections, medications, etc., regional limb perfusions. We will do lameness exams on our own if it presents an emergency or it's needed. So. I would say pretty hands-on. I'm happy with the experience I'm getting here.
Cool. It sounds like a really great internship. Would you, what advice do you have for students kind of coming through vet school or just graduating in terms of internships, externships, just general advice?
So I was pro internship, and which is why I'm here. And I wanted that because I was looking for a little bit of extra mentorship. If that's the correct word. Just a little bit more guidance until I got my confidence and got my feet wet. And I've really enjoyed Littleton, especially because they really have that mentality where they want us to think like doctors from day one. They really want us to do the best that we can, and they've gone the extra mile for me personally, because one of the things I struggled with was making that transition from student to doctor. Like in a day, in a matter of an hour, once you throw your cap in the air, you're the expert. And so for me, having that transition and figuring out my responsibilities and how to handle, talking to clients and especially difficult clients, it was nice to have that guidance. Some people just want to go out and do their work, and that's completely fine. But I really enjoyed the extra mentorship because it does take some of the responsibility away, because they, at the end of the day, the staff doctors and the owners are the ones responsible for the cases here. So I'm doing most of the care, but they are also there, and that's why they pay so close attention to us, which is understandable. But like I said, really enjoyed the extra attention, the extra effort, the extra mentorship, the relationships that we have here. So that's worked for me.
Great. Well, thank you, Dr. Kenney.
You're welcome.
If you guys would like more information about the Littleton Equine Internship, you can check out their website or check out my blog, jeremyshaba.com, and we'll see you later.